My name is Carolina. Let me go ahead and share my screen. Okay, sorry about that. Okay, so we'll start with the health intervention presentation based on the population level. Again, my name is Carolina Farias, and this is for Nursing 445. The two topics that I chose to focus on are hypertension and nutrition related to and leading up to chronic disease in the chosen community, which is the PICFAIR, located in the 90019 zip code. The reasons I chose this topic were the concerns of community members in the PICFAIR village, and because there was about 75% of the community were obese, there was an extreme low activity level on a day-to-day basis. There was unhealthy diet options and lack of access to fresh food, and lack of knowledge regarding disease and correct nutritional intake for the particular disease. The PICFAIR community diagnosis that I chose, and giving this information just to get a better understanding of the community that I am focusing on. And that is focuses on loss of productive years of life among the PICFAIR community related to the lack of access to fresh foods, abundance of high-fat fast food restaurants, decreased knowledge regarding disease process, inadequate financial resources to access healthier alternatives, and lack of knowledge regarding disease etiology, as evidenced by high percentage of sedentary lifestyles and severely overweight adults with chronic disease. So background and significance of nutrition and health for chronic hypertension. This is based on the existing disparities secondary to health promotion that targeted the general public. And when I say general, that was mainly focused on white adolescent male, strangely enough, population, and overlooked the PICFAIR community. It also, the significance of the hypertension existed in about 40% of the population, and this, as we know, leads to increased risk for diabetes, CAD, hyperlipidemia, and stroke. Knowledge deficit related to hypertension management, which includes compliance, physical activity, nutrition, and smoking, and stress. And calories from the unhealthy fats and sugars are the main contributors to school-aged children, and there was overall a lack of knowledge of these issues. When speaking of Healthy People 2020 objectives to be addressed by each of the two health issues, the first was nutrition and health. The objective for nutrition and health for Healthy People 2020 was to promote health and reduce chronic disease through healthful diets and healthy body weights. And hypertension, actually it was more of cardiovascular health objective. So I related to hypertension, and that was to improve cardiovascular health through prevention, detection, and treatment of those risks. Some of those objectives, first of all, with nutrition, were to increase the contribution of fruits to the diets of the population aged 2 years and older. And the second was, I just picked two, just because they seemed to be most related to the topic in hand, was to reduce the consumption of calories from solid fats and added sugars in the population. And then the third was to increase the contribution of whole grains to the diet in the population. When it comes to hypertension, the objective was to increase the contribution of whole grains to diet and population, increase the proportion of adults with pre-hypertension who meet the recommended guidelines for BMI, and also increase the proportion of adults with pre-hypertension who meet the recommended guidelines for physical activity. When speaking of the needs assessment, I found that PICFAIR community, with the help of the Windshield survey, had the following needs. They were to assess, when it comes to nutrition, assessment of nutrition and dietitians and affordable healthcare was limited. Increased knowledge of disease process needed to be expanded, incorporating safety and security to promote walks, exercise, and outdoor activities. Culturally sensitive nutritional goals needed to be included. And with hypertension, decreased knowledge of the importance of medication compliance was insufficient. the access to low-cost gyms and community recreation centers that were offered, and also exercise classes were limited. And finally, access to healthy food options were also limited. The theoretical framework that I chose was the precede proceed model. Just a quick overview, the precede stands for predisposing, reinforcing, enabling constructs in educational diagnosis. Phase 1 and 2 included needs assessment, which includes identification of the problem. Phase 3 identifies environmental risk factors that affect the behavior, and phase 4 is factors affecting behavior. The second part of the theoretical framework was PROCEED, which stands for policy, regulatory, and organizational construct in education and environmental development. Phase 5 is about implementation of a plan, design and conduct of intervention, so putting everything into effect. Phase 6 is process evaluation and the actual implementation of the interventions. And phase 7 is impact evaluation, which asks, is the program reaching the targeted population and achieving the goal? And finally, phase 8 is outcome evaluation, which assesses for the changes in behavior and checks to see if phase 1 goal is being met. Okay, so the issues and obstacles and assets. The issues and obstacles were poverty mean income in pig fair area is about $63,000 in 2015, so that creates an issue. Cultural background and ties that influence food and choices and lifestyles. The other issue was unsafe neighborhoods, no parks in surrounding areas, which decreases the activity levels among the community. There's also a limited access to free or low-cost clinics, limited access to free or low-cost insurance, and also limited fresh food markets. The abundance of fast food or excess of fast food, high-fat, high-sugar restaurants also was taken note. Oh, sorry about that. The assets of the community, were the strong community spiritual background, strong family and community ties, similar cultural backgrounds, which made it easier for people to bond or the community bond. And also there was a strong preschool education options. There was, they have a lot of options for Head Start. So of course kids start out strong in the preschool, but then as the years go by, middle school and high school options were very limited or not acceptable. So the interventions with chronic hypertension, with the Healthy People to 2020, the objective was to improve cardiovascular health through prevention, detection, and treatment of risk factors. So the interventions I incorporated through my teachings would be including teaching about the importance of medication compliance and how to plan a healthy diet on minimal budgets, assist in advocating the improvement of quality of meal services, specifically in the Cochrane Baptist Church, where they serve meals that are not healthy. And my other intervention was to coordinate a nutritional visit from local public health offices, as well as community nutritional support classes, which is still something that I'm working on. I wasn't able to incorporate that with my teaching. My final intervention was teaching about the importance of medication compliance. With health and nutrition, the interventions that I incorporated in my teaching, focusing on the Healthy People 2020, which is to promote health and reduce chronic disease through healthful diets and healthy body weights. I focused on increasing activity levels in the community setting by adding the Zumba class, which was led by a friend of mine. The next intervention was to assist in advocating improvement of quality of meal services, which was basically just talking to the dietitian involved in the preparation of the meals at Cochrane Baptist Church. And then coordinating a nutritional visit from local public health office, as well as community nutritional support classes, and implementing the My Plate teaching. This is a very long process, but I'm hoping to get a dietitian or nutritional support to assess the needs of the public. And then finally, exercise advocate by negotiating and networking to implement the exercise classes to the Cochrane Baptist Church. based on donations. So again, going back to the increased activity levels and advocating for exercise. The budget support and finances, really this wasn't a very expensive task, but I think the further you go with it, it can be more expensive. The handouts and printouts you can see here were $18. Teaching was free. Location, there was no fees charged. The space was free. They were very gracious and very grateful for my attendance there. The only thing that was a problem was changing the diet plan, which is based on a budget for the Cochrane Baptist Church, and the estimated cost increase was $3 to $8 more per meal, which was above the Cochrane Baptist Church budget. Projective evaluation, intermediately evaluate the community's knowledge of hypertension by simply talking to individuals, members, as often as possible. So this was something that how I evaluated. Evaluating results of provided suggestion box. I put a suggestion box there. I haven't had a chance to evaluate that yet, but I plan on doing that to see how communities are responding to the interventions. Evaluating changes in meal services and setting up a table where I can take blood pressures and answer any questions and take note of any blood pressure changes in these individuals. Also evaluate attendance to exercise classes and what the reasons were and what led to low attendance, identification of issues at class times, lengths, and degree of difficulty. This actually breaks it down into the outcome results, how it was evaluated, and the actual evaluation. So it was the same as the slide before, but broken it down into the actual results there. But overall, what I found most helpful was the attendance for the exercise classes, and those are short-term goal objectives, and the long-term objectives would be the blood pressure checkups and possibly weight changes, and also the patient demeanor. The results in conclusion: community teaching lacked organization, location, and setting. It was difficult to get everyone to listen up. People were focused on giveaways. The timing, I think I should have been able to do my teaching before the meal, because as soon as I taught, everyone kind of left because I had already eaten. So I think I also needed more time to take more blood pressures. But I have no problem because I have easy access to the community, so I can go back at any time to continue my blood pressure checks. That is pretty much it. These are my references. Overall, I had a really good time doing this project, and I think I'm going to stick to it after this class because they're kind of counting on me, this community here. So that is basically it. Thank you very much, and have a good night.